people denying that it actually is as bad as it is and thinking that they could just get around it or that they are not going to get it. I've seen that a lot with people, friends, that think they won't get it and then they do. All age groups, it's not just one age group. It's young, it's middle-aged, it's older, it's everyone is getting it, especially, like I said, the people who don't try to use different methods to keep themselves from contacting it. I still saw, like high school kids exchanging food with each other and thinking that they won't get it. Others that are older that adamantly believe that they do not need to wear a mask. They do not need to do anything to help themselves not get the virus. It's important because the same thing with the flu, so that you can do everything you can to try to protect yourself from getting COVID-19. As soon as they announce in my age group, for over 60s to get it, the very beginning, I got the first vaccine, I got the second, and I think it's 3 boosters, whatever, all the stuff that you're supposed to get, I got. And again, I wore a mask when they said to wear a mask. I washed my hands all the time. I used hand sanitizer and just did my best to keep myself as away from people, that I could at that time. It was lonely because I know at first when I was at home and we had to work from home, I didn't see my grandkids. I didn't see my family. They would come and leave Starbucks on my doorstep because they knew how much I love Starbucks. It was a lonely time, but it was worth it because I like I said, I never got the virus. I think I would be one of those ones that may get really ill. And with my age group, it proved to be fatal to a lot of people. So it was available at our school district. Also, all of the drugstores that had it available for free. And most doctor offices would also have it available. I've had people say that it doesn't work. Not that it was harmful, but that it doesn't work and that vaccines do not work. And I'm like, yes, are there people who got the vaccination that may have gotten COVID? But again, the symptoms aren't as bad as someone who did not get the vaccination. And I tried to explain to them the purpose of the vaccination. People that I know, I would be more than willing to help them get it or take them there or tell them of places that are close to them in their community where they could get it. So there is no reason to put up any barriers about why you can't get it. And again, if someone needs me to hold their hand, I'd be more than happy to do that. What are you waiting for? It's important, you need to get it. And because even though some people think that it's not around, it is still around. And you still need to get vaccinated. I've got all the vaccinations, I got all the boosters, and look, I have not, knock on wood, gotten COVID yet.